Personally, I am intimidated by dealing with pets with traumatic brain injury, so I really love this quiz and how it breaks down the various interventions you might consider and why you may or may not use them depending on the circumstance. Even if you have an ER that you can transfer these patients to, you still need to stabilize them before you can refer. So yeah, I found a lot of utility in going through this quiz and challenging some of the things that I wasn't sure about, and also stuff that I thought I knew but maybe didn't know as well as I thought.
Yeah, traumatic brain injuries are like anything else that I feel like we see uncommonly, where you just sort of lose that confidence. And when you're in the moment, sort of trying to make those really quick decisions, and oftentimes an emergent case, it can be really stressful to try to refresh your skills. So, yeah, I love that this quizzes you on some of those medications that maybe you don't think about every day, to make sure that when you are in the moment, you have the skills you need.
I think one of the other really important thing when you're looking at traumatic brain injury specifically is that we have a chance in those very early moments to change our outcomes significantly. And so those decisions that you make, a lot of the injury that we see in the brain is actually, secondary injury from the edema and things like that. And so those early decisions that you make and having that information right there in the moment can really make a big difference in our outcomes. And so it was nice to have this. And just like you said, maybe making sure we're not inadvertently making the situation worse when we're trying to help, challenging some of the things that we may have been taught earlier that are no longer, that have fallen out of favor, things like avoiding steroids and, when you should be a little bit more cautious with your mannitol and maybe switch to using hypertonic saline.